Why do pineal region tumors often lead to hydrocephalus? Imagine a tiny but crucial part of your brain deep inside, called the pineal gland. When tumors develop in this area, they can cause serious problems, especially with the flow of cerebrospinal fluid. The reason is that the pineal gland sits very close to a tiny but vital channel called the cerebral aqueduct. This channel connects the third and fourth ventricles, which are spaces inside your brain filled with cerebrospinal fluid that cushions and nourishes your brain and spinal cord. When a tumor forms in the pineal region, it can grow large enough to press against or infiltrate this narrow aqueduct. Think of it like a traffic jam on a busy highway. The flow of cerebrospinal fluid gets blocked or slowed down, causing it to back up behind the obstruction. As a result, the fluid starts to accumulate in the ventricles upstream, making them enlarge. This buildup increases pressure inside the skull, a condition known as hydrocephalus. This increased pressure can cause a variety of symptoms. People might experience persistent headaches, nausea, vomiting, and even changes in mental clarity. Sometimes, the pressure affects eye movements, leading to specific eye movement problems called Pineal syndrome. Because hydrocephalus often appears early in the course of a pineal tumor, it can be the first sign that something is wrong in the brain. Even benign pineal cysts or smaller tumors can cause this problem if they grow enough to narrow or block the aqueduct. The key issue is the obstruction of cerebrospinal fluid flow, which disrupts the normal circulation and drainage of this fluid. When doctors diagnose hydrocephalus caused by a pineal tumor, they usually need to act quickly. Treatment options include surgical procedures like placing a ventriculoperitoneal shunt, which diverts excess fluid from the brain to the abdomen, or performing an endoscopic third ventriculostomy, which creates an alternative pathway for cerebrospinal fluid to bypass the blockage. In summary, pineal region tumors often lead to hydrocephalus because they block the cerebral aqueduct, preventing cerebrospinal fluid from flowing freely. This causes fluid to build up inside the brain, increasing pressure and leading to symptoms that requiring prompt medical attention. If you or someone you know experiences symptoms like severe headaches or vision changes, it's important to consult a healthcare professional for proper diagnosis and care.